I'm Carly Witter. This is Communication 101, my persuasive speech. Heart disease kills between 35,000 and 40,000 people every year, according to the American Cancer Society. That's a lot of people, but that's not all the people that heart disease kills. It's just a portion of them. The nearly 40,000 people we are talking about here are the ones that have developed heart disease from being exposed to secondhand smoke. They may have never smoked a cigarette in their entire life, but it doesn't matter because they have been endangered the same as a smoker has by breathing secondhand smoke. An additional 3,000 healthy non-smokers will die of lung cancer this year because of their exposure to secondhand smoke. Secondhand smoke is the third leading cause of preventable death in this country, according to Americans for Non-Smokers' Rights website. Is this fair to those of us who choose not to smoke? This audience is made up of non-smokers. Which one of you, or possibly myself, will die of heart disease or lung cancer because we work in an environment where people smoke or we frequent restaurants where smoking is permitted? I hope this information disturbs you and that you will think about how often you are exposed to secondhand smoke. Today I would like to talk about the need for statewide smoke-free laws for public places in Indiana. I have researched the effects of secondhand smoke on the health of the public and the health benefits that have been studied in places where smoke-free laws have been passed. I want to show you that it does make a difference. Some counties in Indiana have passed smoke-free laws, but many have not. We need to protect ourselves from the many dangers secondhand smoke poses to our health by making public places in the entire state of Indiana smoke-free. The laws have been written, they just need to be passed. There's a lot of data from cities and states that have passed the laws showing that it does work and that society will benefit from the legislation. To help you understand the need for smoke-free laws, we first must understand exactly what secondhand smoke is and what dangers it poses. Secondhand smoke is the combination of smoke emitted from a burning tobacco product and the smoke exhaled from the lungs of a tobacco user. The Environmental Protection Agency classifies secondhand smoke as a Group A carcinogen, a substance known to cause cancer in humans. There are no safe levels of exposure to a Group A toxin. Secondhand smoke contains over 4,000 substances. More than 60 of these are cancer-causing. Some of these deadly substances include arsenic, formaldehyde, nickel, benzene, vinyl chloride, and lead. So now you know what secondhand smoke is. It definitely sounds bad for us, but what specifically does it do to our health? The dangers for adults are numerous and can affect any aspect of one's health. Short-term effects include coughing and nasal and eye irritation. And one hopes that this is all they experience, but the reality is that many people suffer much more serious complications from repeated exposure to secondhand smoke. Long-term exposure has been proven to cause the following: a 50% increase in one's chance of stroke, an increased risk of developing breast cancer in young women, a death rate 30% higher than those of non-smokers who are not exposed to secondhand smoke, heart damage similar to that of a smoker's after only 30 minutes of exposure to secondhand smoke, and a 60% increase in risk of coronary heart disease. Adults are not the only people at risk for complications from secondhand smoke. Children experience their own set of problems. Secondhand smoke has been shown to cause the following in children: sudden infant death syndrome, otherwise known as SIDS, asthma induction and aggravation, bronchitis and pneumonia, middle ear infections, chronic respiratory symptoms, low birth weight, an increased risk of spinal pain in adult life, and impairments in the ability to learn. With so many serious health issues attached to secondhand smoke, it is no wonder some governments are trying to eliminate it from public places. Indiana needs to do the same. We need to pass the laws that have been proposed in order to protect our health and the health of those around us. The plan that Indiana has in place would ban smoking in restaurants, bars, and most public places, however not in casinos or horse tracks. Opposition to the bill has come from bar and casino owners believing it would hurt their business. Since the casinos are no longer included in the ban, the bill will have less resistance and therefore a better chance at being put into action. I have a map here from Americans Non-Smokers' Rights Foundation, and it's current as of April 1st of this year. And it shows Indiana with respect to other states in the U.S. And the smoke-free laws that have been passed. The gray states, such as Indiana, have passed no 100% smoke-free laws yet. The blue states have passed 100% smoke-free laws for workplaces, restaurants, and bars, while the green states have passed 100% smoke-free laws for one or two of the three, workplace, restaurant, or bar. Then you can see that states also have small blue triangles or green circles, and these represent local governments, cities or counties that have passed their own smoke-free laws. As you can see, Indiana has a lot of cities and counties that have passed local laws to ban smoking. Why not go ahead and be with the majority of the rest of the United States and make Indiana smoke-free? Studies have shown that business owners have nothing to fear when it comes to making a profit in a smoke-free area. The group Americans for Non-Smokers' Rights has compiled data from smoke-free law economic impact studies around the U.S., and the results consistently show either no economic impact or a positive impact after the smoke-free law goes into effect. For example, in Lexington, Kentucky, business has remained stable since a comprehensive smoke-free law was passed in 2004. In Dallas, Texas, the number of restaurants and bars has been increasing since smoke-free law went into effect in 2003. In the state of Florida, studies found that restaurant sales were up 7% 1 year after the state's smoke-free law was enacted. In California, annual sales increased for establishments selling all types of alcohol, and the amount of people employed in California restaurants and bars increased after the smoke-free policy. This data hopefully persuades restaurant and bar owners that the laws are not bad for business, but the American public needs to be shown that the laws will benefit their health. Several studies have shown the health benefits to entire communities after smoke-free laws have been passed. I'd like to share a few with you that are listed on the American Cancer Society's websites. Right here in Indiana, in Monroe County, a study was done during the 22 months prior to and 22 months following the implementation of a smoke-free law. The results showed a 59% decrease in hospital admissions for heart attacks in non-smokers who had no cardiac history. It also showed that 7 hospitality venues had pollution levels decreased by 89%. New York City had an 11% decline in smoking prevalence that they gave the smoke-free ordinance credit for. This is an estimated 18,000 smokers who have quit using tobacco, possibly preventing 45,000 premature deaths and saving $500 million annually from smoking-related healthcare costs. Helena, Montana had a smoke-free law for 6 months before it was overturned. In that 6-month period, the number of patients admitted for heart attacks dropped 40%, while other cities' numbers remained constant. When the law was overturned, the number of heart attack patients rose again. Is this a coincidence? In California, a group of over 50 bartenders was examined before and after a smoke-free law went into effect. The results showed a 5 to 7% increase in the individual's overall pulmonary function just 1 month after the law was implemented. These studies prove that the laws are good for everyone. They're good for business owners, good for our health, good for the environment, and good for the economy. The only thing bad here is secondhand smoke itself. We know what secondhand smoke is. We know the dangers it poses to adults and children. We know our government officials have written up laws similar to those in other states banning public smoking. We know from studying other communities that the laws work. So why does anyone need to be persuaded? I hope that after hearing this information today, you will become a proponent for smoke-free laws in Indiana, and that you will spread the word to others that secondhand smoke is a killer, and we need to protect ourselves from it by banning smoking in public places. Think about the choices you've made and the actions you've taken to keep yourself healthy and to protect yourself and your loved ones from unnecessary exposure to dangerous situations in this world. Sitting down to eat at a restaurant that allows smoking is a dangerous situation. We all can benefit for fighting for our right to breathe smoke-free air. Come on, Indiana. Don't let this law go up in smoke. Thank you.